was a fantastic conversation. I chaired it really badly in the sense there wasn't much time for people to ask questions and make comments. But I have to say I let it run because the contributions were just out of this world, really, and they complemented each other so well. There was a lot of agreement, really. I mean, it just felt like the beginnings of an incredibly important conversation about what else has to happen to put some more kind of stability and framework and a valuing of everybody who works in social care. And I think there was a recognition that some of the advances that have been made in the NHS and the way they've worked with staff and the way that the voice of the staff has been really important in all those changes was something that social care could learn from. But also an acknowledgement that it's probably a bit easier to do in the NHS than it is in social care because of the fragmentation and, you know, so many different people, you know, not necessarily brought together in the same way. So I think a real challenge there. We had a really good provocation to start with from Victor Adebowale, Lord Adebowale, who was just very frank, as you'd expect, about on the back of the pandemic, particularly in its impact on BAME colleagues, the fact that they've disproportionately suffered during the pandemic, and just a very straightforward call from Victor for us to get it right this time on race. So I think that was an important intervention at the beginning of that conversation about the importance of being inclusive. We heard quite a lot. I think there was a lot of sort of shared understanding, really, that the task of social care is changing and it's becoming more complex because people have more complex needs. And that increasingly what we're going to need is people who are, as David Behan put it, problem solvers, people who are highly adaptable, who are flexible, and we need to develop ways of working that enable them to move in and out of health and care across in a much more natural way. And really, obviously, I think there was an absolute shared agreement that listening to staff, making them feel valued, giving them that self-respect, really, which the system perhaps doesn't give them at the moment, had to be intrinsic to all those changes. And perhaps belonging also in the context of local. There was quite a lot of people saying that, of course, today with the white paper, you know, it very much emphasising in many ways local delivery, but within a national system, that perhaps that local identity, the importance of place, people feeling part of their community and working alongside, you know, co-producing social care with those who receive it. All of that seemed to be an important thing for us to be bearing in mind. We had quite an interesting, needless to say, not completed debate about the whole national versus local. But yeah, it was a fantastic session, and it was really exciting, actually. It made me feel very optimistic, actually, for the future. I mean, I know it's difficult. It's a difficult time. There's lots to be worried about, but there's so many good ideas around. It was a pleasure to chair it very badly.
Right, no, thank you very much. And I'm sure that isn't the case, Caroline. So thank you. And of course, all the contributions that we've heard in the mini summits will be reflected in the final report. So those of you that weren't there to hear that, you'll obviously not just hear that summary from Caroline, but see the detail later. Fantastic. Let's move on to mini summit number 3, new ways of working and delivering care. Stephen, it's lovely to have you, and you know, another former Secretary of State for Health. Fantastic to have you with us. So thank you very much.
Thank you, Phil. Thank you for allowing me to join you. And I can say that our mini summit was superbly chaired, because it wasn't chaired by me. It was chaired by Vic Rayner of the National Care Forum. And there were, I think, 4 key themes that I would draw out of it. The first is that if we're building a workforce for the future of social care, it's nonsense to think of that in isolation from the workforce of the NHS and healthcare, because the integration, if the integration agenda is going to mean anything, it must mean that we think about the services in a joined up way. And if we're going to do that, we ought to think about the skills and human requirements in a joined up way. Philippa Whitford was one of our principal speakers. And she referred to the 2 facts, actually, that I think are relevant to the discussion. The first is that institutionally in Scotland, they're more integrated than we are in England. That's true. It's also true, of course, that there's more integration in institutional sense in Wales and in Northern Ireland. Although Philippa also said, which is definitely true right across the UK, that COVID has forced a pace of integration across the institutions that has people simply joined up and done things together that previously the institutions would have made more difficult. And part of the policy challenge for the future, both in terms of service delivery, but also in terms of shaping the workforce, must be to make certain that we don't go back to old ways anywhere in the UK. So a joined up workforce was theme number one. Theme number two, I think, was an important qualification, not so much a qualification, but an important definition of what we mean by integration, that it can't just be a top-down version that looks good from the institutional top of the tree. Carolyn Barber was one of the contributors to the chat in our section from the mental health initiative, the Good Mental Health Initiative, and reminded us that the skills required are not just those in residential care or in home care, but actually thinking about skills required to deliver a joined up health and care workforce, to deliver on real needs, needs to start not with the strategic plan from the top, but from the needs of the service user community, and build from the bottom up, as Carolyn reminded us. That's proposition one on reflecting real needs. Two other points I think came out of that element of the conversation. The first was from Una Smith, one of the key presenters from Skills for Care, who had some impressive granular evidence about the nature of the workforce we're talking about. 40% labour turnover, for example, among young joiners in the social care workforce. That can't be good for the individuals concerned or for the people who rely on the services they deliver. So some real evidence from Skills for Care, that needs to be fed into the argument. And the important, obvious point, but nonetheless important to state it, that as we're thinking about a joined up workforce, we have to remember we're not just talking about a workforce for elderly care, but for working age care as well. Third theme, we had, I thought, an interesting discussion on the question of registration. And I won't try to repeat it all, but while there was support for the proposition that there needs to be proper training and proper registration of people who have been properly trained and so forth, we need to be careful what we wish for, and extending the methods of the GMC, excellent institution though it is, across a workforce of 3 million people isn't necessarily the right answer. So be careful what we wish for and be clear what we're looking for before we just go down the road of registration, was a theme that came out. And fourthly and finally, Vic was keen that I should report this, which I think is a very important, fair point. If we want an integrated workforce, if we know what it's going to look like in the future, if we have a training systems, do we actually have the capacity to deliver? Can we do? The danger is we write a report that says this is what social care is going to look like in 10 years' time, if we knew, but what are the levers we pull to make that happen?
Excellent. Well, thank you very much indeed, Stephen. That sounded like a really good workshop too. I wanted to be in all of them. That's fantastic. And I've got the fourth and final one, the mini summit number 4, Growing for the Future. And Jackie O'Sullivan, who's the Chief Executive of MenCap and also co-chair with Caroline of the Care and Support Alliance. Jackie, over to you.
Yeah, we had a really, really rich discussion, loads of great ideas and a remarkable level of consensus in our group. So we talked a lot about pay, recognising real terms pay cuts that people have experienced, and also that this would require a significant government funding to rectify this. But we decided that really the minimum we should be aiming at here is the real living wage. And we talked about pegging to various NHS levels or even setting a sector specific living wage. stage, and felt that it's some sort of independent review. The LGA are looking at this at the moment, or maybe a central pay bargaining body might be an answer here. We also talked about, really interesting point, that local authority contracts should actually look at what percentage of those contracts is being passed on to support workers and care workers, and that this might, some move away from hourly rates into outcomes might kind of facilitate that sort of conversation. We thought it would be a good idea to have either a code of practice, which was legal enforceable, that employers would offer, or some sort of statutory charter that would set out minimum terms in terms of career development as well as pay. We had a really good discussion on 0 hours contracts. All agreed we needed to stamp out best practice, but we also recognised we needed to retain flexibility, and that we didn't want to then inhibit some people who might prefer to have part-time working or flexible working. And so really we came down to the idea that we really needed people to have a right to guaranteed hours, and that maybe was the way to tackle that. We talked about regulation and needing reform of regulation, which put quite a lot of pressure on service managers, and really sort of looking at that idea that we want a system where we have continuous improvement rather than a kind of blame culture. We talked about having a portable skills and competency frameworks, which would then enable that transition between NHS and social care. Looking at different entry points, making social care a career of choice, increasing diversity of workforce and how important that was, and then looking at well-being, which is so important at this moment, and also use of technology. So very, very wide-ranging, as you can tell, but lots of really positive ideas that could really propel us into the future.
Well, that is absolutely brilliant. Thank you very much indeed. I don't know how we're going to capture all of this, but I think we've got a huge agenda in front of us, which is great. So we're about to move into, Andy Burnham is about to join us in a couple of minutes to join us for the final plenary session. Before we get to that though, I just want to pull out what I think some of the key themes have emerged from those 4 mini summits, because there's clearly a lot of consensus there to build on. Some of it's about the actual content of what a social care plan for people plan might look like, but some of it's about the process of getting to it. And I think we've got to get both right. So on the process point, clearly how we engage with the staff themselves, to have the voice of care workers is heard properly as we develop and design a good social care people plan is absolutely critical, and that needs to be throughout from bottom up, and very much the voice of care users and their experience of care, and therefore how that affects the care plan, the social care people plan. So those are two sort of principles about the process that we need to be thinking about. Another one was, I think, lessons from other places, whether it's Scotland, Wales, Northern Ireland, or I heard Australia. And maybe there are people that have done this and have cracked some of this already that we could be drawing upon to make it much more applicable. And therefore, if people say it can't be done here, we say it can be done here because it's been done elsewhere. It seemed to me that in terms of content, clearly pay, as you were just describing, Jackie, the rally last week and so on, the nature of contracts, of flexible working. I think that there's a whole area there where people have got very clear, and I think a lot of consensus about the way forward on all of that, including not employers as well as employee trade unions and so on, and right across the sector, which I think is quite important if we've got consensus about where that should go. That's particularly around inclusivity and diversity. It felt to me in all the workshops that came out as being something that has to be both the way we do it and an outcome from what our people plan creates. I think there was some quite detailed technical stuff in some of the workshops that have come out, the idea of a national register and how that works, and that should be something, a stepping stone for people to get into the social care, not a form of barrier to that, and how we make that be that way. The idea, you mentioned a code of practice, a charter, the idea of the career and how the NHS career structure and the social care career structure, if we have one, linked together, not merged, but people can move between them, up through them and across them, really important. And the question of regulation. So we've got a combination of big picture ideas about the way we get there and what that outcome looks like, and some quite detailed technical things that may be quick wins. We could identify things that we could say, this is the way we start to put those pieces of the jigsaw together to get a full people plan. So I'm going to move us on into the final session now, which is the discussion. I'm just not quite sure whether I've got Christina. Are you with us, Christina? Yes, I assume you are. I'm not hearing.
Yeah, I couldn't.
Yeah. Hi, Christina. I think we're just waiting for Andy to join us for a discussion. I can imagine with what's been happening with the white paper, there's quite a lot going on in terms of to what extent it might or might not be helpful to Greater Manchester's devolved approach. Are there any immediate thoughts you'd like to share at this stage, Christina, about what we've heard so far through the conference?
Well, I mean, I was in group one, and I have to say I thought the contributions were fantastic, and I thought Clinton made a brilliant point towards the end, and he said it in his summing up, which was, you know, we don't live in a single issue world, and I think that's so true, because that the connectivity between and the interdependence between social care and so many other sectors, I think all helps with the arguments that we're going to have to continue to make with governments, with you know, decision makers about why it needs to change, because it's too easy to just think of social care as just this little thing on its own, that, you know, lots of people never really have that interaction with it because they never have to use it, or it takes years before you have to use it. And actually it's about that interaction, isn't it, between what happens in social care and the impact that has in health, and the impact that has in the housing, the impact it has on the police service. You know, it has this, if you don't get one bit of this, the jigsaw right, it has this kind of knock-on effect across so many other sectors. So I thought Clinton's point on that was absolutely spot on, and one we should carry through when we're thinking about this. And I thought this, I actually caught the very beginning of Victor's points in group two, and I think he was making some fantastic points as well about what this has put a focus on, which is that social care, not just the workforce, but indeed the people who rely on social care, there's a sort of disproportionate impact of COVID on, as we know, you know, Black communities, disabled people, people who come from low income backgrounds, and it's kind of all concentrated in social care. That's why you've had such a huge impact, both in terms of service users, but also in the workforce. And what we have to make sure we guard against is we don't let the kind of feeling that we've got now slip away as we come out of the pandemic. And, you know, a week's a long time, and is that what the saying is? A week's a long time in politics. I mean, you know, a few months from now, who knows? We might be just, you know, everybody will be thinking about all the other things that have to happen as we come out of the pandemic, and this will have slipped into, you know, things that happened a long time ago. So they are the things I think that I've taken from it.
Thank you, Christina. Well, excellent. Well, I can now move into the last and final plenary session with Andy Burnham, who's now joined us. Andy, hello.
Hi, Phil.
Welcome to the conference. We've had an excellent conference today, Andy, with some real insights as people have got into the detail of what we need to do to improve the care workforce, to give it the kind of recognition and respect and remuneration, and the role that the workforce plays in taking forward what we all want to see, which is, you know, a better social care service for people who are the most vulnerable. So what we'd like to do now, Andy, in welcoming you to the conference, is basically have a discussion with you really about what your take is, both on this, the picture of the social care workforce, the idea of maybe a social care people plan and a social care promise. But before we get into that idea, I was saying earlier, I think maybe you've been busy today with the white paper announcements, and I don't know whether one of the questions that's been around, which is bigger than the workforce question, but obviously directly affects it, is this the time? Is this the opportunity? You know, white paper, a big comprehensive spending review come up in the autumn, when we might see the sort of transformational change for the social care system, or is it a missed opportunity? I don't know what your take is on where things are really. If that's an unfair question to start with, I apologise, but hey, why not?
Not at all, Phil. It's obviously a question on everyone's minds. I've not had the chance to read it in detail, I'll be honest, but I have to say there are echoes in this white paper, from what I understand of it, of the policy that I put forward as Shadow Health Secretary in 2014, before the 2015 general election, because I was calling for a national health and care service, effectively a highly integrated system, much reduced, if non-existent, role for the private sector. Yeah, there are echoes here, I think, of what I was calling for, and I'm kind of, I guess, left with the feeling, Phil, that perhaps we should have rewind the clock to 2012, and the reforms that came through then should never have happened at all. It's frustrating, really, that we had a decade of reforms that really a lot of people in the health and care system really didn't want. The only thing I would put on it is, for anyone who's out there working in health and social care at the moment, do they really have the stomach for a reorganisation right now? I mean, I think that would be the issue that most people would have in their minds today, isn't it? I don't think they will disagree, I don't think, with some of what's being proposed here. It's the timing, I guess, is the main thing that would be in people's minds. And, it's an odd time, I think, to put forward a major reform of this kind. But still, 10 years too late, it would be my first, take on it.
Okay, well, thanks, Andy. Christina, do you want to pick up a question to Andy?
Yeah, so hi Andy, nice to see you again.
It's nice to see you, Christina, and it's the first time I can say congratulations to you properly. Yeah.
Thank you. So, obviously we've been talking predominantly about the workforce here, and I suppose it's a kind of two-part. What do you think are the main priorities for reforming the workforce? But also, it's always seen as too difficult when you're going forward, and, if we wait until there's fundamental change, nothing will happen. Do you think there's anything that can be done now by either or commissioners and providers to actually have an impact on the workforce now, given the current situation?
I do, Christina. I think in some ways the white paper does set this up, doesn't it? Because it's talking about a much more integrated system. And I think you only can move towards that if you, to use a phrase, level up the social care workforce with the NHS workforce. You will never get true integration if you are taking sort of unequal systems and sort of trying to sort of throw them together. Areas like Greater Manchester are trying to do that at the moment. And we are actually, to be fair, making some inroads in the way we're using the strength of the NHS to support social care. But I don't think you will actually get integration until you're integrating two systems and two workforces that are equal, that there's a sort of a parity between the two. So I think that's a precursor for any true social care reform in this country. A plan for the workforce, exactly what you've been discussing today, level up the social care workforce so that they can, as equals, start to work side by side with NHS colleagues. And we start from that basis. And I think you can do something now with regard to integrated commissioning at the local level, where you start to build into the commissioning approach better treatment of the workforce. We have worked hard in Greater Manchester to remove the 15-minute visit as the common currency of domiciliary care. It is still used for delivery of medicine or things that are much quicker, but actually we've tried to begin to take away some of the worst examples of what has been commissioning in social care sector and start to commission for quality. And that, of course, means treating the workforce properly. We've seen during the pandemic with the infection control grant, some of the basics that social care staff should be able to take for granted and can't, being put in place, i.e. if they are symptomatic or they've been asked to self-isolate, they should be able to do so without any concern about their wages or the continuation of their role. I think there are things that can be done, Christina, but I think we need a step change here, don't we, towards parity between these two workforces. And that is a precursor, I think, to much more successful integration. of the two systems. And in some ways, it is by starting with the workforce. Finally, we're looking through the right end of the telescope at the social care challenge. We've always gone straight to the financial challenge, haven't we, and the selling of homes and all of those issues. Actually, start on this road with the delivery of social care and the support for people who work within the system, and then move through the phases in that way. And I think finally, maybe as a country, we're about to get these things in the right order at last.
Thank you.
Andy, that's an intriguing question about where that integration happens and the sort of the local, regional, sort of, national, where do we have this health and social care workforce coming together, either in the planning and management or indeed in any other form of integration. And I wonder whether given Manchester's experience where you've had some control over this, you've been able to do some things in the workforce, that's been at a great GM level, as it were, and below that within the areas. But other people have talked about, well, maybe we need a national framework of entitlements or whatever to ensure that what happens around the country isn't just good in parts, as it were, but is reflected elsewhere. How do you reconcile the kind of your ambitions to have a local strategy, because that's where it actually happens, that's where the people live and the services are delivered, but wanting to create some kind of parity around the country between different areas, and therefore having a national element to that? How do you square that circle?
I think it can be squared, Phil. So nationally, we should set out the what we expect of health and social care in terms of the public's entitlements to services, their rights to services, and the support for staff. That should be a national framework, I think. We should effectively extend Agenda for Change to the social care workforce, and we should extend it used to be called the Knowledge and Skills Framework. I think, is it still called that, Christina? But the obviously the access to ongoing professional development for people to, that's what we should do nationally. Phil, what is left to the local level is then how do you integrate? The question of how is a local matter, isn't it? How best to do it in this particular geography, given our collection of providers and the profile, the demographics of the area. I think this thing can absolutely be brought into proper balance. And I was encouraged actually to hear the report of the Secretary of State today when asked about how does Greater Manchester fit with his white paper, and is this more centralisation and not devolution? He did answer by saying no, he felt this would enable places like GM to go further and do more. So that was encouraging actually, and we were pleased to hear that. So I think a strong national framework around pay, around training, around all of those issues related to staff, and also around public entitlement to services is absolutely right and proper in a national system, but free people up at the local level to decide how best it's delivered in any particular geography or any particular community. And I think then you can get these two things in proper balance.
Well, thank you very much. Christina, do you want to pick up another theme?
Yeah, well, I just think, Andy, you've talked about putting people on Agenda for Change, and I have to say we wouldn't have any objection to that. But I think I've said before, we're not precious about this. We're not saying it has to be Agenda for Change or it has to be NJC, National Joint Council for Local Government, for those who don't know, or a standalone thing. But I accept, I think you're right in terms of you can't get proper integration unless you're doing it from a position of equality, and therefore having that kind of parity across, I think, would certainly work. But partly what we've seen in the NHS is there's a sort of, the people plan also has a people's promise, so it's got a staff promise in it about what they can expect. Do you think that's something, I'm guessing you'd say yes to this, but a sort of promise to the social care workforce, and what do you think would be in that as a sort of, even just as a minimum start of where we could actually make things different?
I really feel very strongly about this, Christina. People who devote their lives to looking after other people's relatives, other people's parents, other people's brothers, sisters, whatever, they deserve the highest rewards in my mind, the best support that we can provide. And actually, it follows with a caring profession, isn't it? That you have to give people security in their circumstances if then they are to be able to pass on security, a sense of security, to the people that they look after. You know, we've kind of left them in a position where we've kind of not even given security to the social care staff who are trying out their, you know, we've let them live with insecurity in their own lives, and then they're trying to pass it on to others, and that just isn't right. It's not right morally in terms of how we treat them as individuals, but it also undermines their ability to care for people and create a sense of security and well-being in the homes of the people that they care for. So I think the idea of a promise to social care staff, recognizing that they have been neglected, undervalued, and treated pretty disgracefully, actually. Let's call it as it is. You know, that this is a source of national shame as far as I'm concerned. I think this has got to be a sort of post-pandemic saying this is actually everyone, and all parties, by the way, I'm not making a party political point here, all parties have neglected social care out of political cowardice. You know, it's deemed to be too difficult to sort out a proper funding system for the way we care for the most vulnerable in our society. Well, no, actually, it should have been something that all the political parties faced up to and agreed many, many years ago. So I think this is a moment of everyone putting the politics to one side. Look, everyone's failed this workforce. We now owe it to them to put it right. And this is a sort of cross-party or cross-societal promise to them that from this point, we will give them the necessary reward, but also the necessary security and the necessary professional development to do their job properly. And we will not allow any more this sort of constant chipping away, constant undermining of them and their role. It's about good employment, Christina, isn't it? It's about secure employment, no more 0 hours contracts, no more casual contracts. It is about decent rates of pay. Real living wage isn't enough as far as I'm concerned, but we can start with a real living wage, let's say, to get the ball rolling. It's then about proper training to do their job, always fully equipped with the right PPE, etc. You know, you can see how this promise would unfold, but it's absolutely what the country should do. And if you take the NHS principle, I understand what you're saying about, you know, the local government side of the house will have, you know, wants the ability to localize this, but actually, what you and I might remember from and Phil, we were around at some of these debates. When there was an attempt to move regional pay into the NHS, I think it was understood how that would destabilise all parts of the NHS. If you start to have one employer undercutting another, or, you know, and then you get the destabilisation effect in the workforce, it would help all. I think it would help social care everywhere if we set out national rates of pay, because then we would stop the situation of a race to the bottom, or the other way, people trying to poach staff and move them around. You would create a stability within the workforce, which is exactly what any health or caring profession needs.
Oh, completely agree, Andy. Thanks.
Thanks, Andy. Andy, we're coming to the end, but there's been quite a lot of interesting conversations on the chat, you know, that goes along with these conferences. And as you know, we've had care users, care workers, we've had former secretaries of state, former ministers of state speaking and contributing, and a whole range of stakeholders and people, 150 people. I get the question as we come to the end is, where do we go next? It feels to me as though today we've identified some very big opportunities for both how we go about developing a better social care people plan in terms of how we engage with people, how we involve people, users as care workers, everybody from the sector, but also what the outcomes should look like. Given we've got such a big group of people who have joined us for this today, all of whom, you know, give or take, you know, there's a huge consensus. Where should we go next with the coalition? What can we do you think, from your point of view, to take this forward as a campaign that has impact and influence, particularly in the very short window we've got really with the white paper and the bill on the reform of the NHS, and potentially a very transformational funding settlement sometime later in the year? Just a kind of, is the glass half empty or half full? And if it's half full, how can we fill it up?
Oh, it's a good question, Phil. Certainly, I would say this is the right campaign at the right time, and actually is coming at it in the right way. So to come back to it, rather than us all getting bogged down in the really difficult questions about social care, this is, I hope, starting with something that everyone can accept, that this workforce has never been treated properly. And there is a duty owed here. And actually, the pandemic has allowed us all to see that really clearly. Frustration I've always had as somebody trying to reform social care over the years, and you know this as well, there's only a very small minority of the population at any time using social care services, or with family using social care services. So we've never had the groundswell for change. But I think we potentially have a moment of groundswell for change. A growing political consensus about integrating health and social care, which actually wasn't there going back a few years ago, but is there now. Growing political consensus about, prioritising the public delivery of health and care. I think that seems to be a growing consensus. So there's a real moment building here, isn't there? I think it's wonderful actually to see the people who've joined, the different names who've been part of this event today. Obviously, I can see Stephen Dorrell still on the call. I know that Jeremy Hunt, I think, has spoken to the conference today. Sir David Bean still with us. I'm looking down. I could list everybody, but some fantastic names over the years. Andrew Dilnott, all of whom have contributed. Frances O'Grady, I think, has been involved as well, hasn't she? So there's some big hitters here, all sort of coalescing around this. I think, Phil, the way to build it from here is to kind of almost sort of say to everybody, there are phases of social care reform that kind of come beyond this, but position this as the first stage of reform is to treat the people in the system out there now delivering with dignity, with respect, with proper investment so that they can do their job. And I don't think there are many people in the country that will argue against that now. And then on that foundation, then we can build towards more integration, and then ultimately, hopefully, a new funding settlement. I think what's really crucial, and Christina and her Unison colleagues helped us with this recently. We had an event with Unison Northwest, which wasn't about the politicians, actually. It was about voices from the front line. And it was, I describe it as the best hour I've spent this year, and probably last year as well. They were just describing the reality of life in the jobs that they do. And it was, to be honest, it's kind of, something that every politician should just sit and listen to. And I'd like to see the campaign put those voices at the front of this, Phil, not so much the politicians anymore. Let the people who've been out there this year and the years before just explain their life and what it feels like to be them. And I think that more than anything just builds the case for change. We've all had a tendency in politics, haven't we, to talk about the nurses and the doctors. We don't talk about these staff. They have been forgotten, out of the spotlight. And I think you've got to get the voices of social care at the front and centre of this campaign, and start with this as a campaign around, parity for the people who care across the full range of needs, physical, mental, and social. Parity for those carers who we've clapped. They want more than that now. We need, it to be recognised that they deserve equal treatment. And I think the public of this country, when they hear those voices, will be absolutely overwhelmingly behind them. And then the political parties finally need to come together, get their act together, and then work through this plan for social care. It feels as though finally, with the white paper and some other things, that we're coming at this in the right order finally. We've always come at it, as I say, through finance first. You've got to come at it first through people, haven't you? Then the structures within which people work, and then I think at the end, bring in the money that will support the vision that we're all sort of nudging towards. So I don't know if that helps, but get those voices from the front line, front and centre. Put the politicians to one side and make them listen. Make them listen to what the lives of people have been like and are like, who've been out there caring for our mums and our dads and our brothers and our sisters every day, and they do it without complaining, and they do it actually, goodness knows, for pay that nowhere near nowhere near goes anywhere to fairly recognising what they do.
Andy, thank you very much indeed. Well, I think on that note, I think I'm going to hand over to Christina to close the conference and give my thanks to everybody. Thank you, Andy, but thanks to all the amazing contributions in the summit and to our plenary speakers. But Christina, over to you to close the conference. Thank you.
Thank you, and yeah, thanks, Andy. That's a brilliant speech at the end, and a great way to end the conference. Actually, is to hear that speaking up so strongly for the workforce and for the people who've been at the front, the front end, the sharp end of what's been happening during this pandemic. But I'd like to thank everyone who attended. I think it's been a great event. Actually, I've really enjoyed it, and I want to thank Phil for brilliantly hosting most of it, and done a great job. And I'd like to thank our keynote speakers. Andy, sadly, Jeremy Hunt couldn't make it. He slipped on ice and broke his arm this morning.
Right. Okay.
So Alistair Burt very kindly stepped in at the last minute and did a brilliant job. And so I want to thank Alistair in particular, and Andrew Dilnock. Brilliant to hear from Andrew on his vision of what's happening now to take us forward. I'd also like to thank all of the speakers and all of the chairs in each of the mini summits, and to thank Jill Morris and Steve Barrick from Devo Connect, who've put this together for us. They've done a brilliant job in actually building the momentum for this. But also, when I look at the list of people who are here, I'm really amazed, and I feel very honoured to be part of this, because it's real big hitters across this sector, from the providers, from politicians, from commissioners, from those who are involved in actually delivering services and representing unpaid carers and also service users, and hearing their voice. And last but absolutely by no means least, I want to thank, and it built on what Andy was saying, I want to thank Shan Stockham, who spoke earlier and who has launched this petition. Shan is, and I'm prejudiced because she's the Vice President of Unison, but she's also a carer who holds down 2 caring jobs and does that. That's her main job, that's her income. And then she volunteers, because as a trade union rep, she's a volunteer to be the Vice President of Unison, and she's been central to this campaign for us. And it's the voices of people like Shan that we need to hear. And I think that suggestion that that's where we go next in the campaign is a brilliant one, and one we'll definitely take forward. So thank you, everyone. I hope I haven't missed anyone out, but thank you, everyone who's taken part today. And I hope we'll all be in touch, and we'll all keep this going. So thank you.
Good luck.
Thank you.
Well done, everyone.
Thanks.
Okay.
Thanks. Bye.